Good morning and welcome to our COVID-19 talk with local health authorities. I have with me Dr. David Persse representing the City of Houston, Dr. Umair Shah representing Harris County. This is sponsored by the Rotary Club of Houston, and I want to give a special thank you to Kathy Finninger, past president, who helps us with these questions. I am Stephen Williams, Director of the Houston Health Department. Well, things are changing a little bit from week to week, right? Federal laws restrict nursing homes from barring patients who are unprofitable. There are watchdogs in 16 states, so it sounds as if this is still happening. What's going on locally? Do we know anything about that?
No, I'm not aware.
Yeah, I'm not either.
That seems to not be something that we have knowledge of. Well, let's go on to vaccines. The common cold is a coronavirus, and we don't have a vaccine. Why not, if we have been able to rush a vaccine for this strain? Yeah. Well, you do, don't you, for some?
Well, we have to remember COVID-19 is a part of the family of coronaviruses, and typically, again, the reminder, this is like back to months ago, the coronavirus family usually causes very mild symptoms, very mild illness, and so that's usually the family of the common colds and other kinds of infections. So there wasn't really a lot of appetite to have a vaccine developed because, you know, most people would have a common cold, they'd a couple days and they'd be done, they move on. It's that COVID-19 is not just a common cold, it's actually a animal origin disease that made a jump as a novel virus into the human population. We have no immunity to it, and we have a lot of people that have had complications and actually have died. And we know that there have been, unfortunately, a million deaths across the globe. And so there's a real concern then about developing a vaccine to prevent this virus from continuing ad infinitum forever. And so that's the reason why there's been the development of a vaccine effort.
The other thing is to keep in mind for the public is that when we talk about colds, you know, we sort of think about what there's a cold virus. Well, there's not. There's actually many cold viruses. Some of them are coronaviruses, and some of them are other family viruses. So and I just don't think that there is, I suspect that from the pharmaceutical industry there wasn't a business model that worked. And that's why they never did it, I suspect.
Yeah.
In China, it's said that hundreds of thousands of people have received vaccines from late-stage trials. Not sure if the population was given a real choice on participating. If it is successful there, do you think that that data will be of value? In other words, could that data be used on U.S. trials?
I think the data will be valuable, but we have to remember that it depends on the actual specific vaccine formulation. So if you've got data from one type of vaccine and you're comparing it to another type of vaccine, yeah, it's important to know about that, but it's not going to be completely tied to your vaccine that you're actually having the trials with. So I think it'll be helpful, but it's not going to be a perfect help. But, you know,
we're going to have to wait and see what the data shows, see what the reports are. I mean, you know, I mean, let's assume that it shows to be effective and that there's poor consequences. That's great, but again, it was specific with vaccine, and is that vaccine going to be available in the United States? So.
Right.
Uh-oh, they're reversing roles. Stephen, please summarize the new mental health initiative, HESS, Health Education and Support Services. Well, this is an initiative that is sponsored by the Houston Health Department, but it's actually going to be implemented by a nonprofit agency. Basically, you know that during COVID, there has been a number of behavioral health issues that have surfaced around COVID. The isolation, the stress of parents having to work and engage their children in virtual learning. And so what we've decided to do is to support an effort to staff a behavioral health hotline for people to call in. There will also be connections to other services and support services relative to this. That hotline will be available from 1 o'clock in the afternoon until 10 o'clock at night. And it starts today. Today is October the 1st. I'll try to get that number to give to folks. And it's really available to the whole community, but one thing that we're going to do is to this particular outreach into zip codes where there have been very high positivity rates. There are other hotlines that are available within the community, but this is something that we thought would be an added value.
Well, you know, I agree with you. There are other hotlines, but I'll say this is great. I mean, you know, just kudos to you, Stephen, and the health department, and you know, Dr. Persse, because you know, we know oftentimes physical health is what we concern ourselves with. We don't always think about the mental behavioral health, spiritual health, emotional health. And so kudos to you for taking on, you know, that kind of a specificity of and extending those hours from 1 to 10 p.m. is huge. So thank you for doing that.
Okay, on to the next question. On September.
By the way, all the questions you can answer. We're good with this format.
Well, I might try when the day that y'all don't show up. The show will go on. On September the 28th, JAMA published a research letter about the exclusion of older persons from vaccine and treatment trials. Since this is the most at-risk population, why would they be excluded?
I'm not familiar with that letter.
So exclusion of...
They're saying that exclusion of older persons from vaccine and treatment trials, meaning that...
The only thing I can think, I'm not familiar with the letter. The only thing I can think of is that we do know that as we get older, our immune system, like many of our organ systems, becomes less robust. And so if the purpose of the trial is to see what kind of an impact it would have on an immune system, you know, using on elder folks, mixing, you know, with that, I'm speculating here, is, you know, may sort of blunt the impact. It may appear to be less effective than it really is if you put it as a population of people who are going to have a weaker immune system. That having been said, we do know that with the seasonal flu vaccine, we now have a different dose regimen for elder folks. And so that was specifically tested and analyzed in order to get there. So with this flu, well, not this flu, but with this vaccine, I would speculate that they're looking for the more average folks to see what kind of response, and then later do specific testing on elder folks. I don't know that, but I would.
Here's a question for you, David. There's no, as far as I know, from the exclusion criteria for vaccine trials, I don't think age is one of those excluders, is it? Does it go to like a certain age?
Like I said, I'm not familiar with this letter.
Yeah, we'll have to look that maybe in a break.
Okay. That's going to be a question from next week. Thank you for joining us for our COVID-19 talk with local health authorities. We'll be right back.
Learn to cough and sneeze with your pal, Grover. Step 1. Realize you're about to sneeze. Step 2. Move your elbow toward your nose and mouth. Step 3. Gesundheit. 1, 2, 3. Remember to cough and sneeze into your arm or elbow and not your hands.
Welcome back to the COVID-19 talk with local health authorities. Dr. Shah, I think you have a follow-up answer to the question that we just talked about regarding older adults and vaccine trials.
Yeah, just really quickly, I looked it up. We talked about it. The JAMA, the article is, what they're saying is that NIH has been trying to include older adults, and this group of authors said that it looks like they feel there is being now exclusion of older adults in those vaccine trials, and it's advocating for older adults to be included. So we support that, but obviously we want to make sure it's done safely for the population that's being evaluated for.
Thank you to technology. And I also have the call line number for the mental health support that we talked about earlier. That number is 713-999-9442. 713-999-9442. And it's open, actually, starting today from 1 p.m. until 11 p.m., not 10 p.m.
Oh.
And it's going to be operating from October 1st today through December the 24th. Okay, last week you mentioned completing the antibody testing survey. What are the results?
We don't have the results. That's the serology test.
That's the serology test. We don't have the results. We're expecting the results in about 2 weeks, the middle of the month.
And we're starting that antibody testing seroprevalence study. But thank you for your help with the protocols, et cetera. So we'll complement that with not just the city, but throughout the county.
So hopefully in a couple of months we will actually have information for everybody.
That's right.
Okay. David, you had just mentioned this during the break. Houston Public Works is testing the city's wastewater to detect the presence of COVID. To what micro level can this testing occur, schools, streets, etc.? How would you alert those impacted that their area have tested positive?
Yeah. Well, what I say is it can be as specific as to a building. So we have already, for example, done a couple of homeless shelters in the Harris County Jail. Now, Harris County Jail is a large building, but some of the homeless shelters are smaller. So it can be done to be as small as a building. And it has to do with the pipes and the flow and all that, right? And so what we've already been doing is we've been getting the results. The health department's been targeting some of the zip codes that we know, and we've been going in those neighborhoods and with some of the efforts for the health department to increase testing, awareness, education. We've been going door to door in some cases.
Yes, but we don't necessarily publish the specific zip codes. One of the things that we struggle with is being able to do the kind of focused targeting in terms of outreach, but not really stigmatizing the areas. Right. We do look at clusters, for instance, and we know that there are there are high positivity rates in certain clusters of apartments, but that's not necessarily something we publish. We just let that information influence our work.
Right. And just to add on to that is that we've looked at wastewater outside of the city in the non-city portion of the county, but we've got 400 or 500 different water systems that make it quite hard to actually, I think it was 456, quite hard to actually go forth with that. So we're looking at, is there some smaller group that we could do, but it's a very different setup when you get outside of the actual city core.
Yeah. The Access to COVID-19 Tools Act, Accelerated Global Collaboration, announced $120 million to support affordable antigen-based rapid tests for low and middle income countries. Some say that these tests are fast, accurate, game changers. Others say they're only a complement to PCR testing. Does this mean it requires both for accuracy? That comes up a lot, doesn't it?
So I believe, I believe if you read the fine print, it says that the negative test should be followed up with a PCR test.
Yeah, that's correct. I wanted to make a global comment, which is that there are a lot of countries, I read actually about this morning, and strangely enough, that there have been a lot of countries that have been really not contributing to the global fund, if you will, U.S. included, China was another one, and they've been really trying to push these countries to contribute. Canada, for example, has contributed, and I think it's a real global issue where it's really about both vaccines as well as therapeutics, and then having enough dollars that are going to help the entire world so it's not just excluded to certain countries. So I think that's the global comment. But in addition to that, I do think it allows for screening, but then you may, for certain kinds of results like negative, you may have to do follow-up. So it could be a game changer. It just depends, but it has to be used correctly.
Okay. Please help settle my dilemma as I'm forced to stay away from my family. If I have COVID antibodies, does this mean I am no longer contagious?
So I think that if you are ill and you've got the antibodies and it's a short term after your illness or your infection, you may not have even gotten ill, you should no longer be contagious. The problem, however, is that your antibody level will drop off. We just don't know how fast it's going to drop off, and it appears to vary from one person to the next. So, that's the problem. Like when you got tested, you got antibodies, you probably, I'm be interested in what you have to say, you're probably not contagious, but don't think that you're not going to be contagious if you get infected again.
Right, there are two kinds of antibodies. One is this sort of kind of acute, like right away antibody.
Yeah.
One is more of a longer term antibody. David's right, when you get to this longer term, there over time it'll wane. And the issue is that a lot of these tests are either positive or negative. They don't tell you a percentage or a number. They just say, yes, you have the short term, or yes, you have the long term, or no, you don't. And it doesn't tell you how much. And so just because you might have a little bit of the long term versus somebody who has a lot, but it still says yes, yes to both tests. And so it doesn't automatically mean that you've got the immunity from either the infection or what have you. So again, it has to be taken in the full picture of what's going on with that individual.
Yeah.
Okay, transmission. I know it's early, but we're planning for the holiday visits of children from college. My husband is an at-risk person, but I don't want to ruin the visit. Your guidance for minimum precautions we should take.
No hugging.
No hugging.
Yeah, so like when my daughter comes to visit our house, we visit outside. If we're inside, we're not eating, we wear masks. I mean, it seems kind of like over the top to some degree, but that's just what we do. You don't drop your guard. I mean, the virus is the virus. It doesn't care whether it's in your house or in the neighborhood.
Right. The one thing I would add to what David is saying is this rule around eating. I think what I'm really concerned about is that people are using the eating exemption to drop the mask, and they're like, yeah, I have water in front of me, and I'm not really taking a bite. I'm actually just sort of away from my plate. I'm talking, but it's okay not to have my mask. The answer is that if you're actually not eating or drinking actively, meaning you're really just, and you're not 6 feet away from that person, you're actually putting that other person at risk, including yourself. So what I would advocate is really be attentive to those in-between behaviors that also can spread risk. If you truly care about your loved one, like your daughter, or your daughter cares about parents or grandparents or uncle, aunts, etc., then let's make sure we're really seriously taking those social distancing and those mask rules, because that's the way you're going to actually help each other.
Okay, in 1 minute, the CDC considers a person to have a fever if it is over 100.4. Although this is a baseline, everyone has a different normal. Is there a better screening tool to enter doctors' offices, etc.?
Well, one quick thing I would just say is that the state of Texas actually has 100.0, so there is a little bit of a difference. But I think it's really about temperature check and just really to be, look, these are all guides, these are all screening. It doesn't mean they're fail-proof.
Right.
Thank you for joining us for COVID-19 Talk with local health authorities. We'll be right back.
Wash, washy, wash, washy, wash, wash your hands. Scrub it while you sing this song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
You have to stay home.
Not just to protect yourself, but to protect others.
Stay at least 6 feet away from other people. 2, arm's length. Just because you're at home
doesn't mean that we can't be alone together.
Have questions about the coronavirus?
I'm here to share some simple steps you can take to help protect yourself and others.
Avoid touching your eyes, nose, and mouth. Wash your hands often with soap and water for 20+ seconds.
Cover your cough or sneeze with a tissue.
Clean and disinfect surfaces and objects. Wash hands after touching commonly used items.
Together, we can help slow the spread.
Welcome back to COVID-19 Talk with local health authorities. I wanted to remind you that this is sponsored by the Rotary Club of Houston. JAMA mentioned COVID-related skin manifestations. I read that skin rashes and COVID fingers and toes could be the only sign a person shows. Have you seen this as a first symptom?
Not as a first symptom.
No, I don't think I've seen it as a first symptom. I did read some time back a couple of articles. So this is a little bit off the, but people who had what they thought were COVID toes, and there were two articles. One had like 30, the other had like 20 people in it. Turned out none of them had COVID toes. None of them tested positive for COVID, but they had skin lesions. And what they figured in these two articles was because people are at home, so walking around barefoot more, and they're changing their foot hygiene, and they were. Now, the fact of COVID toes and COVID fingers, I think is a real thing because we've seen it in the hospitals. I don't think it's an initial symptom, but I just don't know for sure.
Yeah, and I haven't heard about the rash, but we can look for the next week.
Okay. Early voting places. What are the protocols you have recommended?
Wear masks, stay 6 feet apart.
And there's also a lot of sanitation, sanitizing between use and things of that nature. And then obviously there's been a lot of back and forth around mail-in versus actually going in person. And then, people who have to really understand their own risk. If you're older with underlying health conditions, that's where you have to really take particular caution.
Yeah, the last time I voted, it seems like it was almost, I won't say overkill, but there are a lot of precautions in terms
of... the last time I voted, actually, I got in and out. It was amazing. But the time before that, there was a huge line outside, which means the weather then becomes an issue, right? And in the inside, I noticed that, they had pretty good control over the crowd. And this is pre-COVID, so there wasn't any spacing. But outside, there was, it was single file, but there was no control over the crowd. There was nobody out there people were sort of on their own getting in line, but there was no control mechanism.
Yeah, early voting is also a good idea because it gives you, if you're going to do it in person, because it gives you the opportunity not to spread.
Right.
The National Institute of Allergy and Infectious Disease mentioned that a new strain of COVID has become more contagious and may resist hand washing and social distancing. True or not?
Well, there's the new version, and this is really not that new. This is a while ago. It's more contagious, but it's not resistant to hand washing, not that I know of.
No, and in fact, there's some kudos to our partners at Texas Medical Center, Baylor College of Medicine, because they were part of the ones that were actually helping to identify it.
Right.
Harris County Public Health Department shows 14-day average for COVID-19 testing positive rate hit its lowest point since May 25th. Does this reflect how well we did on the Labor Day weekend? Are all backlog tests now recorded?
Not all of them. We've, as I mentioned last time, we had essentially, if you think about 3 batches, we did a batch 3 weeks ago now, and then one that was 2 weeks ago, and then we have another batch that was last week into this week, and maybe even early next week. And so we're still going through them. Really, a lot of it is about the incomplete information. It's not even the backlog. It's just clearing out incomplete information. So we're close, but it does reflect overall that we've done well as a community, and we want to continue to keep that fight up.
New York positivity rate tripled after they had contained their numbers. Is that due to schools reopening, and can we expect that here? We were talking about that before the show started.
So New York City's positivity rate has tripled. It's gone from less than 1%, I think, yesterday morning. Last night it was like 3.25%. So it's still really low. Whether we can blame it on the schools, I don't know, because I think that they didn't really open up their schools greatly.
That's right.
Yeah.
Yeah, I think it's really, the concern that we have is COVID fatigue. Just people at some point, because we don't know if people are doing what we're asking them to do. We hope they are. But if you get COVID fatigue and you're just like, I'm not going to wear the mask, I'm done, I'm not going to wash my hands, I don't think it's a big deal, then that's when a community as a whole, that's when communities get in trouble.
But I will take this opportunity to challenge Houstonians. We're at about 6%. If New York City has risen to 3%, why isn't New York City doing better than we are? Keep your mask on, keep away from people. Do not let New York City outperform us.
There you go. I like it. Very nice.
Some of my friends have not taken this seriously, this virus seriously, until recent announcement of NFL cases. If a team who has been exposed comes to Houston, what is your role in advising team management?
Well, you know, David and I have both, we've been, you know, both together as health authorities, but also the two health departments have worked together to, you know, give guidance to, you know, Texans and work through that. Again, we don't approve the plans. There's not that jurisdictional or that authority piece. That's at that, you know, essentially at that state level. But we do give guidance to what we think that the plans can do to improve. And you know, I think our role is, honestly, and this sounds unfortunate, is that hoping that everything goes well with those plans and the enactment of those plans is to follow up. And if there are people that get exposed and get sick, that we can at least contact trace and do those things after the fact.
Yeah, and the NFL has got their own medical infrastructure and their medical leadership. And I believe, if I saw it correctly yesterday, the Titans, which is the team that had the cases, they played the Vikings last week. The Vikings are supposed to be coming to town this week, hence the question. But I believe the Titans game for this week has already been canceled. Is that right?
Postponed too.
Postponed?
Either it was a Sunday game going to either Monday or Tuesday against the Steelers. Yeah, so
okay.
So unless it got canceled overnight, but it was postponed.
I knew there had been some sort of a change.
Yeah.
So.
Okay.
Yeah. While they're doing more testing so that they can figure out what's going on with the players.
In answer to what's the next crisis, we have brain-eating amoebas in Lake Jackson. How are the disinfectant level monitored? Haven't these amoebas historically been in bodies of water? Is this related to COVID? What remediation is Houston-Harris County taking?
All right, I'll take the first stab at that. So, first of all, this particular amoeba is ubiquitous in natural water bodies across Texas, right? And unfortunately, every year it seems like we hear of a case of somebody who gets it. In Lake Jackson, in this case, they think that it occurred at a splash pad because if you drink the water, your immune system, your intestine, your digestive system will generally eradicate the amoeba. You have to get it way up in your nose, and then there's a way for it to get across from your nose into the brain. So basically, that's why they think it was the splash pad. So I think the people who are drinking water just need to understand that. Now, within the water system, so in the city of Houston, the Houston Public Works system, they have got an incredibly elaborate system that we go and visit with them at least once a year and just kind of go over things and keep up to snuff. But they have an incredibly elaborate system of protecting the water. And it's tested literally, I think it's thousands of samples a day are tested in their lab looking for these sorts of things. So we have a tremendous amount of redundancy in the water system. So I think people can feel pretty safe.
And I would say that, you know, warm waters, lake waters, that this is really, as you said, around Texas, this is something that unfortunately we do see.
Okay, last question. It feels as though everyone has been drinking more during the past 6 months and feelings as if they need it desperately. Is this of a concern?
Well, yes. I mean, you know, drinking more hopefully is hydration with water, but I think the question is more about alcohol and, you know, unfortunately a number of substances, whether it's alcohol or other kinds of either prescription or other drugs, street drugs, et cetera. These are concerns for all of us right now that we want to make sure that's not happening in our community, but unfortunately it is. Yeah,
so we're on EMS hat. We've measured an increase in alcohol and drug 911 calls. And this kind of goes back to where we started this morning with the behavioral health and the fact that people are, if they're drinking and using drugs more, it's because they're under more stress. And there are other ways to take care of that pressure.
Do you have that phone number?
It is seen as a stress reducer. 713-999-9442. 713-999-9442. That is our call hotline for folks that are experiencing difficulties and want some level of intervention. Thank you for joining us for our COVID-19 talk with local health authorities. Thank you, Dr. David Persse, representing the City of Houston, Dr. Umair Shah, representing Harris County. Thank you to past President Kathy Feniger of the Houston Rotary Club for providing us with these questions for what, like 27, 28 weeks. I am Stephen Williams, Director of the Houston Health Department.